Okay, I wanted to shoot one more quick video today that I think will be really helpful for people, and it's about the diagnosis climber's elbow. And the term climber's elbow refers to nothing more than non-specific elbow pain on the front side of the elbow. So non-specific literally means we're not exactly sure where it is, what caused it, etc. And the front side of the elbow is the most common location for climbers to get this because we do lots of elbow flexion. So I'm going to zoom in just to make sure we have some understanding where we are. This is the right elbow. I'm going to zoom in really closely. It's very likely one of a couple tissues that could be irritated if you're having front-sided elbow pain. The one that's on top that we can see the first is the tendon of the biceps brachii. And if you remember from other videos, the biceps long head is the one that runs up deep into the shoulder, and then the short head attaches to the scapula on the front side of the shoulder. But the tendon of the biceps brachii, if we fade the other muscles, attaches right across the front of the elbow on the radial tuberosity of the outside arm bone, which is the radius. Okay. The other muscle that is usually implicated or is on a differential diagnosis list would be some sort of tendinosis or tendonitis of the brachialis muscle. So if you look at the brachialis muscle, we look at it from the side, the brachialis muscle does not cross the shoulder like the biceps does. The brachialis muscle lives in the mid part of the humerus. It crosses over the elbow joint and it attaches very close to the attachment for the biceps brachii. Let me fade the other muscles right here. You can see that the brachialis muscle attaches very closely. However, the brachialis muscle attaches on the ulna, which is the inside arm bone, on a little process called the coronoid process. The other potential muscles that could be irritated is one, the pronator teres muscle. The pronator teres muscle attaches to the inside of the elbow and crosses the joint at an oblique angle attaching to the arm bone, responsible for pronating the hand. And then the last one is the brachioradialis, which is a sizable muscle, much larger than the pronator teres, also crosses the front side of the elbow joint. When we talk about which muscle we use the most, more than anything, it's likely the brachialis muscle. The brachialis muscle, if we isolate this muscle, this is the muscle that's responsible for flexing the elbow when the palm is facing away from our face. So if you're doing like a regular pull-up, the brachialis muscle is the primary muscle doing that job. If you're doing a chin-up, by contrast, that is the biceps brachii muscle's job. So I won't show the movement on this app because it doesn't actually differentiate, but if you're doing a chin-up grip pull-up, you're using the biceps brachii muscle. If you are doing a regular grip pull-up, you are primarily using the brachialis muscle. And certainly you're using all of those muscles at the same time. But if we think about the specifics, what do we use the most specifically? And that's going to be with our hands facing away from our face. So hopefully that gives you a good understanding of the potential reasons that you might have front-sided elbow pain. And the good news is that the exact same principles apply in regards to what do I do. It does not really matter which tissue is involved. Like you have pain on the front side of the elbow, what we want to do is we want to increase the load to the elbow, right? So we can load as much muscle mass as we can. I want to load the biceps short head. I want to load the biceps long head. I want to load the brachialis. I want to load the brachioradialis, and I want to load all the elbow flexors here on the inside, right? So we're going to increase the load. We're going to reduce the velocity, right? And we're going to keep the volume low. We're going to keep the volume down because we don't want to irritate the tissue, but we want to make sure that we're increasing the load to make sure we keep our strength, and we want to make sure we load the entire tissue. So we want to load all those tendons as best we can, which is the job of slow, heavy resistance training in all sorts of different manners. So hopefully that helps you out through the weekend. If you have some elbow pain, make sure you warm it up really good before you get on the wall.